Hello and welcome to our presentation. We looked at the disparities that impact Native Americans.
The native tribes in America have been targeted since the beginning of colonization, with indigenous presence and resistance being referred to as the Indian problem. They presented an obstacle to expansion for the colonists that direct war failed to overcome. So, over time, the primary solutions became removal, forcing tribes off their ancestral land into chosen reservations, and the assimilation policies, which were enacted with the express purpose of decreasing tribal size and power by forcing tribes to join Western society, eliminating their ancient traditions. These policies targeted native tribes' culture, their ability to sustain themselves, or enabled individual and corporate actions that took advantage of their silent status to exploit and steal their lands. These historical inequalities have led to severe disparities in the modern day for both urban populations and those living on reservations. Our thesis is that poor health outcomes among Native American populations are the result of the cumulative effects of environmental racism, destitute community conditions, and disproportionate sex related crime.
The first topic we will be discussing is environmental disparities. I broke up my section into three parts. The first is climate change. So, Native Americans are expected to be among the population groups most vulnerable to adverse effects of climate change. Some coastal villages in Alaska have been flooded, and changes in plant and animal populations are happening because of the thawing tundra. Alaska Native villagers are among America's first climate refugees. And the definition of a climate refugee is a person who's been forced to leave their home as a result of the effects of climate change on their environment. The next topic I looked at was water. So, over 13% of tribal homes lack basic access to safe drinking water and sanitation services, compared to less than 1% of homes nationwide. Decreases in water quality and quantity are affecting Native Americans' drinking waters, their supplies, their food, their cultures, ceremonies, and traditional ways of life. Historical and contemporary federal and state land use policies and practices, political marginalization, legal issues associated with tribal water rights, water infrastructure deficiencies, and poor socioeconomic conditions contribute to the inability to get access to safe and reliable drinking water. The last topic I looked at was air pollution. The rate of asthma in Native Americans and tribal populations is almost double the national average. This could be because of oil and gas industries, which dump millions of tons of air pollutants into the air each year. Native American communities are much more likely to live close to these oil and gas operations, and because they live so close, they experience a higher frequency of acute health impacts. Some action strategies that are already taking place are for climate change. Tribes are leading in efforts and working with universities like University of Oregon and University of Washington to address climate change in their area. For water, the EPA is working with tribes to make sure that the Safe Drinking Water Act is being adequately put into work in their for their tribe. And for air pollution, the EPA and other organizations are educating tribes about air pollution. Once I completed my research, some further steps that I think need to be taken are state and national government leaders need to listen to Native Americans and the environmental disparities that impact them. Resources and information about the environment and climate need to be easily accessible to Native American tribes, and continued research on solutions needs to continue to be looked into and funded.
As many people know, sex trafficking is a huge issue in the US, but Indigenous communities are hit with the reality of it much harder. It was found an average of 40% of women involved in sex trafficking identified as Indigenous or First Nations, even though the Native women represent 10% or less of the general US population. Lisa Bruner of the National Indigenous Women's Resource Center stated that congressional findings are that Native American women are raped 34.1% more. Um, 6 in 10 will be physically assaulted, and Native women are murdered at more than 10 times the national average. Midwest areas have been particular places where sex trafficking has increased. One such reason for this is through the fracking industry, since man camps were established in remote areas of Minnesota, North Dakota, and South Dakota, since the lack of supervision and toxic environments brought these people to be able to target young and vulnerable Native women. According to Valora Emus Nasanhoya, a Hopi expert on human trafficking in Indian country, she explains the targeting of Native women occurs for several reasons. The Navajo Hopi Observer remarks that this is just a continuation of the marginalization of Native populations in the United States, since historically speaking, Native women have been fetishized, bought, sold, and traded ever since European colonizers arrived. One trafficked woman showed me a list of services in her daily quota. This is a quote from Imus Nasunhoya that from age 14 to 17, she had to make $600 a day, but she never saw a dime of that. Unsafe environments have led to perfect areas for traffickers since there's high rates of poverty, historical trauma and cultural loss, and homelessness and runaway youth, and exposure to violence, drugs, and alcohol, and there's very low levels of law enforcement. In acts to try and solve these crimes, tribal nations, particularly the Navajo Nation, have begun implementing anti trafficking laws such as the Violence Against Women Act, which raises awareness to these communities in training initiatives, and they're hoping that several tribes will follow suit. And the US government, the State Department's 2017 Trafficking in Persons report discuss actions to combat sex trafficking of Native Americans. And some of these plans included increased funding, collaboration with tribal nations on training programs, increased efforts to identify victims, human trafficking training at all National Indian Gaming Commission regional conferences, and increased resources, training, and technical assistance from the Department of Health and Human Services. And the Minnesota Statewide Human Trafficking Task Force was established by state legislation in 2006, in particular just for Minnesota action, since it is a huge issue in the Midwest.
Moving on to education and poverty disparities. More than one quarter of the Native American population lives in poverty, and the US Census Bureau's statistics reveal that 20% of Native American families with children live in poverty, whereas those with children younger than 5 do. So these numbers are more than double those of the general population and are even higher in certain tribal communities. Um, there are fewer individuals within the American Indian and Alaskan Native population who possess a high school diploma or GED or a bachelor's degree. And you can see the statistic on here, the 71% versus 80 and the 11.5% versus 24.4. The poverty and unemployment observed in American Indian and Alaska Native communities is related to broader economic development challenges in American Indian and Alaska Native communities, including geographic isolation and the availability of largely low-wage jobs. Without money, people are less likely to have health insurance or seek medical care. Nearly 1 in 4 American Indian and Alaskan Natives lack health insurance, compared to 11.7% uninsured rate for the entire U.S. population. Now that we know the education and poverty disparities, we look at ways to help this. In the Native community, We learn, for example, the cultural activities are especially important, and yet many people working with Native communities are not knowledgeable about that community's culture. So, to begin changing and improving education in poverty, people first need to learn their culture and respect it to incorporate it into the changes and improvements. Now, MJ Murdoch Charitable Trust and the Oregon Community Foundation are foundations created to begin to change the educational disparities in Native American community to help these children and communities grow as a whole, because education is such a foundation for building a great community. And finally, as always, dialogue about these issues to spread awareness of these issues. We just need to continue talking and spreading awareness of these issues.
Native American peoples have much higher rates of disease and mortality, with 42% of their population being under the age of 24. Both chronic and infectious disease rates are much higher than other groups. The combined weights of generational trauma and the disproportionate abuse and assault rates contribute to poor mental health, with Native patients averaging higher psychological distress across the board. Their alcohol mortality is 6.6 times higher than whites, and rates of drug abuse are also worse. These elevated addiction levels are thought to contribute to higher mortality, domestic abuse, and unemployment, further damaging mental health in these communities. As previously mentioned, tribes are often struggling with water access due to issues like mining, radioactivity, and pollution from factories and pipelines. Similarly, historical actions have led to poor food access, with many tribes relying on food from land that is increasingly impacted by climate change and overhunting or fishing. Being forced to travel to purchase food and water increases the financial burdens on already poverty stricken communities, and the quality of food contributes to the rates of diabetes at double the white population and deaths from diabetes at triple. Despite the high levels of health concerns, Natives have poor healthcare access and insurance coverage, with many people having to travel long distance for even basic care. In addition, there are barriers in the healthcare itself, with high levels of racism towards clients and many experiencing their cultural practices being patronized. In additional barriers, the generational trauma these peoples have, with many communities experiencing high levels of distrust with the healthcare system. With improving healthcare access and effectiveness, taking the historical and current situations and cultures of tribes into account can improve healthcare outcomes. Incorporating the barriers specific to this population is essential, such as improving access for homeless groups, providing transportation for those that live long distances, factoring in lack of phone and mail accessibility, and taking mistrust and healthcare professionals' racial biases into account in training or retraining workers. Building community trust is also essential, interacting with the community through methods that are most accepted in their cultures. Similarly, the best success in helping sex trafficked women has been through culturally based interventions. Specifically working to help Native women from sex trafficking and abuse, studies have found that impactful treatment requires incorporation of essential cultural aspects such as their spirituality, the role their community plays in their healing, and recognition of traditional healing practices. Due to the highly individual nature of tribal communities, cultures, and experiences, the individualized healthcare has been most successful in effective health outcomes. This is done by developing different strategies for each local tribal group, considering their individual traditions and history with medicine, as well as the challenges they face.
Some key findings that we want our audience to remember first regarding environmental disparities is that Native Americans are greatly impacted by climate change, unsafe drinking water, and air pollution, and they are one of the populations most exposed to and affected by environmental disparities. For sex trafficking, statistics have proven that Indigenous women experience the horrors of sex trafficking at a much higher rate compared to other Americans. But both tribal nations and US governments are starting to take action through task forces, acts, and training programs in tribes to combat the threat. For education and poverty, disparities have had a huge effect on Native population. And there are foundations such as the MJ Murdoch Charitable Trust and the Oregon Community Foundation that are working towards better educational systems for Natives. Lastly, for regarding the health of Native Americans, as a result of the environmental and social inequalities they face, Native Americans have some of the worst health outcomes of any populations. Interventions to improve these outcomes should focus on improving accessibility through improved access to resources and increasing cultural understanding. Thank you.